Suicide is a leading cause of death in Alabama. That's according to a study by the CDC.
Huntsville Emergency Medical Services is reporting a major increase in calls related to the new 988 suicide hotline, as the death rate in Alabama hovers above the national average. As News 19's Archie Snowden joins us now in the studio to tell us, since the inception of 988 in July, Archie, those calls have gone up tremendously.
That's exactly right, Jerry. HEMSI is reporting that they received over 1,700 calls between January and June. But between the month of July and August, after the rollout of 988 hotline, they received 500 calls related to suicide and suicide attempts, a staggering increase to say the least. Suicide is something that no one wants to talk about, but on the heels of Suicide Prevention Month, mental health experts say it's a critical conversation to start. UAB Children's Hospital reports that mental health challenges have been an overwhelming factor, especially after 2 years of isolation and uncertainty. Don Webster with Huntsville Emergency Medical Services says that suicide deaths and attempts are on the rise.
Now we've got inflation, and so is it financially driven? So there's a lot of factors that fit into that.
The switch to 988 has increased calls for help, but Wellstone of Alabama is reporting that calls to the new suicide hotline have tripled in the past month, and age has not been a factor.
Yes, it is alarming. In a way, though, I'm really happy that we're able to do this for individuals.
Tara Barley is the 988 suicide hotline coordinator for Wellstone of Alabama. Her job is to make sure that folks who are in crisis receives those services that they need in order to prevent the clutches of an unstable environment.
One of the things that our state has done has expanded access of those calls coming into the state. And so within the regions, there is a crisis center accepting those calls.
The CDC reports that suicide is the leading cause of death for people between the ages of 18 and 24, and the second leading cause of death for people between the ages of 10 and 34 in the state of Alabama.
It's very alarming because you don't realize how many people are struggling, how many people are needing someone to talk to, how many people don't know what resources there are in the community.
We're just trying to make sure that we're working toward and working with other health care services, other agencies to make sure that people can get the help.
Now, the 988 hotline is available 24/7, and you can call or text that number if you need help for mental health issues. Wellstone says that the line connects calls to crisis counseling and resources and referrals, and in some cases, a mobile crisis unit may be dispatched. You can call if you are concerned about a loved one and need resources.